Welcome to Let's Talk Portsmouth, a new communications enterprise developed by the City of Portsmouth's Marketing and Communications Division. If you're interested in Portsmouth news and information, public concerns, and other relevant topics that could impact your life, Let's Talk Portsmouth is the podcast for you. We'll talk city business, including interviews with city administrators, hold discussions with civic and community organizations, and converse with newsmakers from around the state on topics close to home and heart. Now, here's your host, Sharon Hoggart.
Well, I know it's a little late, everybody, but Happy New Year to everyone. Welcome to Let's Talk Portsmouth, the podcast. I'm your host, Sharon Hoggart from Marketing and Communications. And as usual, we've got another great interview lined up just in time for kicking off the new year right. We're going to talk about your health. And I also want to mention to you guys, for posterity's sake, that we are getting ready to face Snowmageddon. So the city is all out winter storm weather preparation. And so we're going to keep it rolling. But first, stay with us. We got some messages for you right quick, and we'll be right back.
Are you considering a career in law enforcement? Sign on today as a Portsmouth police officer and receive up to $1,500 if you're already Virginia certified. We offer a $1,000 allowance for a bachelor's degree and a $500 allowance for an associate's degree on top of your base pay. Officers can also earn additional income on time spent in court and at community events. Visit our website at portsmouthpd.us for more information on how to apply.
If you've been struggling with maintaining good health, or you lack knowledge about different types of diagnoses, this show is for you. If you want to take control of your wellness, prevent disease, and adopt a healthy lifestyle, you're in the right place. Joining us on the podcast today is J.R. Locke, Vice President for Community Development for Healthier757. It's an initiative with the primary goal to improve the health of our citizens and the economic prosperity of our region. But first, to warm up the old vocal cords, we have a little icebreaker question for our guest. J.R., welcome to Let's Talk Portsmouth.
Well, welcome. Thank you for having me this morning.
Tell us a little bit about your background, including where you were educated and your professional experience.
Well, starting with originally from a little town called Gary, Indiana. You may have heard of it.
Most definitely.
It is the home of many people know as the Jacksons. Yeah. We call them the Jackson Five. Mm-hmm. And yes, I did go to school with the Jacksons. Oh, primarily Tito and Jermaine.
Okay. Wow.
So very familiar with the family. And upon leaving Gary, Indiana, I attended Idaho State University, which is out in the Intermountain West, where I received a bachelor's degree in business administration, specializing in management and organization. After a few stops, after graduating from Idaho State, I moved to Wisconsin, spent a little time there in a little town called Racine, Wisconsin. Then I moved to Evansville, Indiana, spent a few years there, and then relocated in 1988 to Hampton Roads. I've actually been here for 34 years now, mm-hmm. and worked for Hampton Blue Cross and Blue Shield, Hampton University, spent some time. I started my own business, which was Executive Search Solutions and Diversity Consulting. Mm-hmm. Many people know it as EBM. And currently, I'm Vice President of Community Development with Edlogix and Healthier757.
All right. Now we know why you are here and how you got here. So let's get the interview started here. At the top of the show, we mentioned that Healthier757's primary goal is to improve health of our citizens. Tell our audience what Healthier757 is and what the mission is.
Well, to start with, Healthier757, it is a multi-stakeholder. We look at it as an integrated community-based program, bridging the worksite, home, and the community that's designed to connect 757 residents through the digital health platform and serve as a vehicle for advancing health literacy through increased awareness, communication, education, and engagement, and behavioral change. It's a regional approach to really encourage people to have better health that provides community-wide digital access to a peer-reviewed, evidence-based health education content that will ultimately help reduce health inequities and improve outcomes. As you know, Sharon, improved health outcomes really is designed to increase the productivity of the local workforce, which in turn improves the attractiveness of the region for business creation and recruitment. The project will support existing healthcare and economic development initiatives and help align across Hampton Roads. And the primary goals and objectives of Healthier757 and Rewards for Healthy Living are to establish Hampton Roads as one of the most health literate regions in the nation, increase community-wide awareness and knowledge of key health issues, increase health equity by eliminating health disparities and addressing social determinants of health, promote economic development in our region through a healthier and more productive workforce. And Sharon, our goal is simple. We want to improve the health and economic prosperity of our citizens and the region.
Okay, Edlogix is the driver in this initiative. Tell us what it is and how the company is involved in Healthier757.
Okay. Edlogix is a digital health communications company headquartered in Virginia Beach that is focused on transforming the way people learn about health. Healthier757 is managed by Edlogix nonprofit partner, Global Action Platform, which is a 501c3 out of Nashville and a leading university business alliance that advances scalable, sustainable solutions for abundant food, health, and prosperity across various communities.
Okay, so I guess now what you're saying that health really is wealth, isn't it?
Absolutely.
So how does the Healthier757 web-based program, how do you all use it to educate the public about various health topics? How does Healthier757 program increase health literacy?
Okay. Consumers use the platform, they can use the platform across any device with the internet connection through interactive health games, multimedia educational programs, innovative gamification strategies, and rewards for educational achievement. The Healthier757 platform actually delivers a personalized user experience that uniquely educates individuals on common and costly healthcare conditions and the challenges of navigating the healthcare system, because a lot of people, as you know, really have some difficulty knowing which services are available and how to access those services. So the platform provides trustworthy, evidence-based health information, improving health literacy, and empowers consumers to take greater responsibility for managing their health.
And I think you may have answered our next question, which was, how does low health literacy impact the American public?
Well, wow, that's a great question. And low health literacy is one of the strongest predictors of an individual's health status. An NIH National Library of Medicine report actually shows that Americans with low health literacy cost the United States economy between $106 billion and $238 billion annually due to increased emergency room and hospital use, medication and treatment noncompliance, and misinterpretation of instructions. When individuals understand their health and are engaged in their care, clinical and financial outcomes tend to improve.
Okay. So let's talk about the Rewards for Healthy Living interactive website. This is the Healthier757 initiative, uses that Rewards for Healthy Living to increase health literacy. So what is Rewards for Healthy Living and how does it work?
Well, that's a really interesting question. I mean, the realities of low health literacy are staggering. 90 million Americans, Sharon, are at risk for preventative health problems because they have difficulty understanding health information. I don't know about you, but it certainly has happened to me. Your patients forget up to 80% of what their health professional told them before they get to the parking lot. That probably has never happened to you.
Of course it has.
And individuals with low health literacy are more likely to visit emergency rooms, less likely to follow treatment guidelines, and more likely to have increased mortality rates. African Americans in particular are disproportionately being diagnosed with COVID-19 and are suffering a higher mortality rate. Individuals with low health literacy are more likely to be vaccine hesitant and more likely to have increased mortality rates. High health literate employees are subject to reduced absenteeism and high productivity. Mm-hmm. And Reward for Healthy Living is a consumer-facing platform that leverages Edlogix interactive digital health platform that's designed to educate, engage, and communicate with diverse audiences. And imagine an exciting and dynamic game-based program that actually grabs the attention of the user at the very beginning. It's easy to use, readily accessible to anyone with the internet. And the health topics addressed in the platform include coronavirus, mental health, diabetes, opioid addiction, chronic health conditions, cancer, caregiving and senior medication use, health insurance, telemedicine, and navigating the healthcare system, just to name a few, from the enormous library of available topics that we actually have for platform users.
Mm-hmm. Rewards for Healthy Living is an interactive game. So what are the tangible benefits to individuals using this platform?
Well, the tangible benefit is that it delivers a personalized user experience that uniquely educates employees and their family members on common and costly health conditions and the challenges of interacting within the healthcare system. It actually educates citizens on chronic and costly health conditions and the importance of treatment plan compliance, which is important to the success of living a healthier life.
Mm-hmm. But people can also, and I think we may address this later on, but people can actually win prizes, correct?
That is correct.
Mm-hmm. Okay. So what has the public's response to Rewards for Healthy Living been?
Well, it's been great. It really has been tremendous. We have a few thousand users already on the platform, and we've done very little marketing, and that's expected to grow with our partnerships on the Healthier757 platform that we will be discussing later. Mm-hmm. And we have just recently initiated a marketing campaign working with Wavy, TB10, and WTKR. Every time we show the platform, people get very excited about it.
Mm-hmm. All right, JR, sit tight for me. We need to take a pause for the cause. We'll be right back.
Getting a flu shot helps us stay healthy, so we don't miss out on what matters. Like that family movie night your daughter can't live without. Yeah, can't do that. Every year, millions of people in the U.S. get the flu. Especially now, no one has time to miss out on moments that matter. So get your flu shot. Find out more at getmyflushot.org. Brought to you by the AMA, CDC, and the Ad Council.
Okay, we're back. This is our final segment in this episode of Let's Talk Portsmouth. We're continuing our conversation with J.R. Locke from Healthier757. So, how does the health information in the Healthier757 platform differ from what you find from a Google search or from WebMD?
Well, that's a great question. So how many times have you Googled or have you've heard people say, I'm going to Google this information?
Yep. All the time.
Sometimes, that tends to make you cringe a little bit. Because you're thinking, you're going to do what?
I'm going to Google this health condition. I'm going to Google it.
Yes, I'm going to find my most informative information on Google. Well, first of all, you never really know where the information comes from when you do a Google search. We actually have a team of individuals at our company that include clinical advisors who are MDs and pharmacists who actually review information that go on our site.
Mm-hmm.
We also purchase information that includes high quality videos and articles from vendors that specialize in providing credible and certifiable information for use on our platform.
Mm-hmm.
So we try to make sure that people can rest assured that when you come onto our site, the information that you're receiving is been certified and is very, very credible.
And folks, I want to put a plug in here. The Rewards for Healthy Living, the platform is fun, it's active, it's interactive, it's entertaining. And so you do get information and you're able to retain that information. It's not as intimidating as WebMD. And you should check it out, and we'll give you more information about that later on. So what are the incentives for logging in and playing the Rewards for Healthy Living?
Well, as I stated, the Rewards for Healthy Living platform is a web-based and mobile optimized solution that leverages interactive multimedia education and game-based learning to deliver that personalized, highly effective path to improve health. We actually have over 82 different modules of content covering a broad range of health topics, from chronic conditions such as strokes, cancer, heart disease, hypertension, diabetes, coronavirus, and asthma, to preventative health connecting with navigating the healthcare system.
Mm-hmm.
In addition to that, the system runs on a modern, scalable, secure, we're HIPAA compliant, cloud hosting technology infrastructure.
Mm-hmm. And y'all plan on adding more health topics in the future. Can you tell us a little bit about that?
Yes. Some of the topics we're planning to add is, infant mortality, diversity, equity, and inclusion, and a number of other topics that we feel would be, very relevant to people wanting to know how to improve their health.
Mm-hmm. What target audiences are you trying to reach with this initiative?
That's a good question. Although the platform is available to all residents throughout the 757, the Healthier757 digital platform will target resources to high-need, underserved populations throughout Hampton Roads. Factors such as the social determinants of health are statistically associated with poor health among Virginians. On average, African Americans in Virginia live 3 to 5 fewer years than Caucasians. Virginians with the lowest level of education experience mortality rates that are 2.7 times higher than those with the highest levels of education. And in Hampton Roads and around the nation, and right here in the city of Portsmouth, Black Americans are at a higher risk of developing and dying from diseases such as heart disease, stroke, diabetes, and cancer. These same chronic conditions also disproportionately impact younger African Americans. The health of higher risk populations within communities impacts the health of our entire community. So we feel like this platform can really serve a viable role in not only helping people to live healthier lives, but maybe to prevent some deaths that are occurring, unfortunately.
Mm-hmm. And let me throw this out at you and out to the listening audience. By using emergency rooms and not knowing enough about these chronic health conditions that we experience, this kind of stuff is what drives up the cost of healthcare, doesn't it?
Oh, absolutely. Many times, unfortunately, when people don't have either health insurance or understand their health insurance, one of the first things that happens when a illness or accident occurs is, I need to go to the emergency room.
Yep, they don't get preventative care.
They may call somebody and tell them, this has happened to me, and ask the question, what should I do? People's first thing that comes to mind is, well, you should go to the emergency room.
Mm-hmm.
Not really understanding the fact that that is the most costly setting in which you can receive healthcare.
Mm-hmm. Even the ride to the emergency room is costly.
Oh, yeah, absolutely. If you go in an ambulance,
yep.
You're right. That is very costly.
Mm-hmm.
And so people have to have a better understanding of knowing, what available resources they have at their disposal, as opposed to just running to the emergency room, where nowadays, I tell you, it is very challenging to go to the emergency room because of COVID.
Yep.
You can go there. I recently had this experience myself, and having to go there for a condition about a week ago, and walked in there and was overwhelmed.
Mm-hmm.
I mean, there were over 30 people in front of me. I actually left and went to another hospital.
Okay.
So that I can get treated sooner.
Well,
and it turned out it worked in my favor, because as opposed to waiting behind, 30 patients, it was only 3 patients when I went to this other hospital.
One of our local healthcare systems is even put out a advertising saying, the emergency room is your last resort. Don't come. Do this, and this first, unless your coronavirus. If you have coronavirus and it's progressively getting worse, then make that trip. But they're saying, take these other steps first before you go to the emergency room.
Right.
Yeah. Okay. So let's talk a minute about the Healthier757's partners. What organizations have joined the initiative?
Well, we've had some tremendous response from organizations. I mean, we're collaborating with many community-based and faith-based organizations. And then some of our partners do include Healthy Portsmouth Coalition,
Mm-hmm.
Healthy Chesapeake, health systems such as Centera and Chesapeake Regional Healthcare, United Way of Southampton Roads, Reinvent Hampton Roads, Urban League of Hampton Roads, the Hampton Roads Prostate Forum, Old Dominion University, EVMS, the Brock Institute,
Mm-hmm.
Hampton Roads Community Action Program, Boys and Girls Clubs of Southeastern Virginia, the Girl Scouts of Colonial Coast, the food banks, both on the South Side and the Peninsula,
Mm-hmm.
Hampton Roads 757 Proud, and WTKR and Wavy TV 10. And Norfolk State, who we are currently working with, they will become the first HBCU in the nation to implement our platform to improve the health of its students, faculty, and staff. And this is just to name a few of our partners.
Wow, that's interesting. We're talking to 2 professors from Norfolk State on our next issue of this podcast.
Oh, wonderful.
So
we also plan to partner with other municipalities in addition to the public and private schools,
Mm-hmm.
Throughout the 757 region.
So what role will the Healthier 757's partners play in the long-term project?
Well, providing access to the Healthy 757 digital platform is essential. They'll have the opportunity to provide, important data that will become valuable in creating strategies to improve health outcomes, through efforts of regional leaders and healthcare stakeholders, developing strategies to enhance the Healthy 757 digital platform to become a community responsive tool to effectively improve health literacy and address health disparities, throughout Hampton Roads and the Commonwealth of Virginia. This health literacy model can become an example for other communities throughout the country and position Hampton Roads as a model for building healthier communities.
That's right, because if we can replicate this in other communities, it'll spread and be beneficial to other communities as well. Okay, so where can people go to find out more about Healthier 757 and the Rewards for Healthy Living initiative?
Well, that is a good question. That is an exciting question, because they can go to www.rewardsforhealthyliving.com, and there they'll be able to find out just how exciting this program is, because they'll have the opportunity to really find out more about Rewards for Healthy Living and how it drives consumers better healthcare decision-making by participating through interactive health games, multimedia educational programs, innovative gamification strategies, and what really gets people excited, they can find out how they can receive cash rewards
Yes.
and prizes for educational achievement.
Yep.
We actually give away $500 in cash prizes the first of each month. We give away some cool prizes such as hotel stays and dinner vouchers the 15th of each month. and we have a jackpot cash prize of $5,000 at the end of the year. So for those enthusiastic players who like to learn about their health, it puts them in a better position to be part of that raffle and can win that $5,000 grand prize. And that really does get people get people very excited. However, in the state of Virginia, you must be at least 18 years old to win cash prizes. And as we grow, those cash prizes will increase and the prizes will get larger. It's our goal that one day we'd like to be able to offer a car as our grand prize at the end of the year. All for learning about living a healthier life.
You heard it here first, folks, on Let's Talk Portsmouth, okay? We want you to go to that website, rewardsforhealthyliving.com, and start playing and start learning. Or should I say start learning and start playing? All right, we're about to wrap up this issue of Let's Talk Portsmouth. Here's more news you can use from our partners. Stay with us.
You took the first step and quit smoking, but even former smokers may still be at risk for lung cancer. That's why SaveByTheScan.org wants you to know about a new low-dose CT scan that can detect lung cancer early. It takes only 60 seconds and could save your life. You took the first step, now take the next. Visit SaveByTheScan.org for a simple quiz to see if you're eligible and talk to your doctor about screening. SaveByTheScan.org is brought to you by the American Lung Association's Lung Force Initiative and the Ad Council.
All righty, you've been listening to Let's Talk Portsmouth, the podcast that's all about the historic city of Portsmouth and its connections across the Commonwealth, the continent, and the globe. Thank you, J.R. Locke, for joining us on this issue of the podcast. It's been a real pleasure. Any final thoughts for our listening audience?
Yes, thank you for asking. I would like to first thank you, Sharon, for allowing me the opportunity to come on to talk about Healthier757. And I'd like to thank the Healthier Portsmouth Coalition and all of its partners for the launching of its New Year, New You campaign. I would also like to thank all of our community partners for supporting a Healthier 757 community initiative and just having the opportunity to share with you and your listeners this morning. Rewards for Healthy Living. Remember, www.rewardsforhealthyliving.com. I encourage all of your listeners to go on the platform and register and play to win, learn, and have a good time finding out about some very valuable information that can improve the health for them and their families.
And that's how you end the interview, everybody. Thank you so much. There's an old adage that says, walking is man's best medicine. Walking is free. Just step outside and go. Start your journey to wellness and healthy living today. Visit podbean.com for this issue of Let's Talk Portsmouth. Listen and download our Let's Talk Portsmouth wherever you listen to your favorite podcast. Happy New Year. We're out of here.
Thanks for listening to Let's Talk Portsmouth, the podcast that's about the city of Portsmouth and our connections around the globe. Listen and download our next episode for more news you can use and information that may just change your perspective. Find our podcast where you find quality podcasts, the Podbean app, Spotify, and Amazon Music Audible. Until next time, take care.